Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How fibroid pain is treated. Fibroids are growths that develop in the uterus. They do not necessarily cause symptoms but, in some cases, can cause pain. Treatment depends on symptoms, the location of the fibroids, their size, and whether a person wants to get pregnant in the future. /r/n/r/n If you have severe pain or bleeding, your doctor may recommend making some lifestyle changes to better manage your symptoms. If these changes do not help, your doctor may suggest prescription medication or surgery. If you have fibroids but do not have any symptoms, your doctor might take a wait-and-see approach. /r/n/r/n Here's an overview of some of the ways that fibroids can be treated. /r/n/r/n/Verywell, Jessica Olahrnrn Home. Remedies do not eliminate fibroids, but they may help some people get relief from fibroid symptoms such as abdominal pain. /r/n/r/n Remedies that you might want to try include /r/n/r/n The first treatment you can try for discomfort and pain from fibroids is over-the-counter pain relievers such as ibuprofen. /r/n/r/n If you have bowel-related symptoms from fibroids, you might prefer to avoid nonsteroidal anti-inflammatory drugs, NSAIDs, because they can have gastrointestinal side effects. /r/n/r/n Excessive bleeding caused by fibroids may require you to take iron supplements. However, you should talk to your doctor before taking any OTC supplements, including iron. /r/n/r/n If your fibroids are accompanied by severe bleeding or pain, your doctor may prescribe medication that specifically addresses these symptoms. /r/n/r/n Medications that might be prescribed to treat bleeding and pain caused by fibroids include /r/n/r/n trial published in 2021 showed that taking a daily combination of the GnRH antagonist relugolix and estradiol and norethindrone acetate is an effective treatment for bleeding caused by fibroids without causing bone loss. However, more research is needed to confirm the results. /r/n/r/n If you have very large fibroids that are causing severe symptoms, your doctor might recommend that you have surgery. However, depending on the procedure, fibroids may come back and more surgeries might be necessary. /r/n/r/n Types of surgeries and procedures for treating fibroids include /r/n/r/n All surgical and non-surgical procedures carry a risk of complications. More invasive surgeries that require an abdominal incision have higher risks, such as infection. /r/n/r/n Some laparoscopic surgeries involve cutting the tissue into small pieces for easier removal, morcellation. There is a risk that the cancerous tissue will spread with laparoscopic power morcellation, therefore, only contained morcellation should be performed in appropriately selected patients. /r/n/r/n There's very little research on the effectiveness of CAM therapies for fibroids and fibroid symptoms. /r/n/r/n Most of the studies that exist involve small sample sizes. However, some research suggests that CAM therapies, such as acupuncture, may help some people cope with chronic pain. /r/n/r/n Some people find relief from heavy bleeding and cramping with acupuncture, but there is no evidence that acupuncture can shrink fibroids. /r/n/r/n Doctors may prescribe ibuprofen, a medication that shrinks fibroids, before surgery. Shrinking the fibroids makes it easier to remove them. /r/n/r/n Shrinking fibroids can temporarily help with symptoms, but it's not a long-term solution. There are ways to treat the symptoms of fibroids, including pain and bleeding, but they cannot cure fibroids and will need to be used continuously. /r/n/r/n Currently, surgery is the only option for permanently removing fibroids. Even so, not all surgeries guarantee the permanent removal of fibroids. If the uterus is left intact, fibroids can grow back. /r/n/r/n While a hysterectomy ensures that fibroids won't return, it also results in loss of fertility. Some people may choose other treatment options because they still wish to get pregnant. /r/n/r/n It's possible to get pregnant if you have fibroids. However, pregnancy hormones may cause the fibroids to get bigger, and having fibroids increases the risk of a complicated pregnancy. /r/n/r/n Fibroids can also cause pain during pregnancy. However, not all treatment options are safe for pregnant people. Birth control cannot be used to treat fibroids if you're pregnant, and some OTC supplements and medications are unsafe to take while pregnant or breastfeeding. /r/n/r/n During pregnancy, the typical treatment plan for fibroid pain involves pain medication and hydration. /r/n/r/n While OTC pain relievers called nonsteroidal anti-inflammatory drugs, NSAIDs, are often used to treat fibroid pain, these medicines can be harmful to a fetus. If you are pregnant, you should only take NSAIDs under the close supervision of your doctor. /r/n/r/n Some pregnant people may require prescription pain medication. In rare cases, it is possible to get fibroids surgically removed during the first half of pregnancy. /r/n/r/n If you're experiencing heavy menstrual bleeding and pelvic pain, it's important to tell your doctor. These symptoms can be caused by many conditions, but if they are related to fibroids, you will want to learn about your treatment options. /r/n/r/n You and your doctor can talk about different treatments, which could include medication and surgery. There are also lifestyle changes and techniques you can try at home that might help you cope with fibroid pain. /r/n/r/n Treating fibroid pain during pregnancy usually involves OTC pain relievers, bed rest, and hydration. You should talk to your doctor before taking any OTC products, however, because it is not safe to expose a fetus to some of them. /r/n/r/n You'll have pain after any surgical procedure and while you are healing. You might need to take pain medication for at least a day after your procedure. Total recovery time can take 2 weeks to several months. /r/n/r/n The pain from fibroids depends on where they are located and how big they are. Large fibroids are more likely to cause pain than small ones, but small fibroids can also cause symptoms. /r/n/r/n Fibroid pain can cause acute pelvic pain, but it can also cause vague sensations of discomfort in the pelvic area. Fibroids can also cause lower back pain, rectal pressure, and pain during sex. /r/n/r/n Some people have fibroids and do not have any pain or discomfort. They might not even realize they have them. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.